Hello and welcome back to the Clinic Minute. I'm Dr. Tara Brown, and today we will be talking about men's health. June is Men's Health Month, so it's the perfect time to discuss essential tests and screening for men of all ages. Let's start with some of the big hitters: prostate health, cardiovascular disease, diabetes, and high blood pressure. Prostate cancer is one of the most common cancers in men. For most, screening starts around age 50. But if you have a family history, your doctor may recommend starting earlier. The most common test is the PSA blood test, which checks for prostate-specific antigen levels. It's quick, simple, and can catch problems early. Heart disease is the leading cause of death for men in the US, so getting your blood pressure checked regularly is crucial. But don't stop there. Cholesterol screenings are also very important to understand your heart health. Men should be screened at least every 5 years, but risk factors like family history and age could require more frequent testing. And in my practice, I include the cholesterol test in your yearly wellness labs. High blood sugar and high blood pressure often go hand in hand, and both can quietly damage your heart, kidneys, and more. Anytime I diagnose hypertension, which is high blood pressure, it is an indication to screen for diabetes. If you are overweight or have a family history of diabetes, we'll likely suggest a fasting glucose, or more commonly now, an A1C test to check for type 2 diabetes. The big idea here is that these tests aren't just about the numbers. They're about catching small problems before they become big ones. Oftentimes, we recognize a pre-diabetic state and can help a patient turn that around with lifestyle changes. A hot topic right now in men's health is testosterone deficiency. Testosterone is a great treatment for symptomatic hypogonadism. That's just fancy words for patients with appropriately drawn low levels of testosterone that correspond to symptoms such as ED, low libido, and loss of body hair. Weight gain and fatigue are non-specific symptoms. Recently, the FDA removed false box labeling on the risk of cardiovascular disease, heart, and clot risk. For those with truly low testosterone levels, the medication can be very safe. However, giving testosterone to men can cause infertility, elevated blood pressure, and cause a person to produce too many red blood cells. Other risks include testicular shrinkage and development of breast tissue. If a person has or has suspicion for obstructive sleep apnea, then it is important to test for, treat, and turn that around prior to treatment. A simple blood test can measure your testosterone levels. If they're low, that could be caused by stress, poor sleep, obstructive sleep apnea, like I mentioned, certain medications, or an underlying condition. The correct way to draw testosterone is in the morning between 8 and 10 a.m., and low values must be confirmed with repeat testing. In some cases, testosterone replacement therapy might be an option, but the key is to not guess. Get tested for and find the best treatment option for yourself. And finally, let's talk about testicular cancer. It's not common, but it's the most common cancer in men between the ages of 15 and 35. As life would go, a person close to me didn't find his until he was 42. The good news? It's highly treatable, especially when caught early. That's why we encourage monthly self-exams. You're looking for any lumps, swelling, or changes. If something feels off, don't ignore it. Schedule a visit. Early detection saves lives. Men, we know life gets busy, but your health should never take a back seat. During Men's Health Month, take one simple step and schedule a checkup. Ask the questions, get the test, because taking care of yourself isn't just for you, it's for the people who count on you too. Thanks for watching.